Star Valley is just a wonderful place. It's where I grew up and it's where I wanted to raise my family. I was blessed with the opportunity to come back and practice among my friends and family, and I'm very happy to be here.
People often have a misconception that in rural communities that perhaps the medicine is really backwards and not state-of-the-art. And we are very proud to be a part of a very growing and dynamic and actively developing medical community.
So we have access to similar technologies that they'll have at bigger facilities. We have amazing radiologists on staff. We have ultrasound technicians that are very skilled at what they do.
We have state-of-the-art 3D digital mammography, for example, state-of-the-art bone densitometry or DEXA scans. So we have absolutely all of the availabilities and technologies that a lot of the larger city hospitals, if you will, have.
We offer the routine care anywhere from cervical cancer screening to breast cancer screening, and most of that care can be done here. And if we find something that needs to be addressed by a specialist, we arrange for that.
Rural agricultural community, farming, ranching communities, we certainly see a lot of health-related injuries perhaps from these different workplaces and work settings, farming accidents, but also maybe chronic conditions related to farming.
During labor and delivery, we also have access to wireless monitoring, so if moms don't want to be tied down to the bed while they're laboring, we can use wireless monitoring so she can get up, walk around the labor and delivery unit, and things like that that just help make the whole process go a little bit more smoothly and more comfortable for the family.
Big hospitals, I've heard that you're a number, they just try to get you in, get you out. And rural hospital, you get a lot more personalized care. I feel like, especially Dr. Morgan, he knows who I am. He sees me out at the fair and he's like, hey, how's it going? How's your babies doing? It's so awesome because the personalized care that you get here at Star Valley Health is amazing.
You got to really embrace and love being a family doctor in a small town, because you do get that, and you just got to grab onto it and love it and be there for these patients, because I go to the grocery store every once in a while and I do get questions, what were the results of this test, or what about this complaint of my elbow? And we're all people, we're all human. We like to get advice from our doctors, and we're there to help out.
The uniqueness of the hospital system here is that they do have a more personalized attention given to patients, and that is comforting to know.
We just had a really good experience in the hospital with the, not only with our doctor, but with the nurses, the OB nurses who helped, and then also the nurses afterwards with our stay in the hospital, who kept watch over us and helped to make sure that me and the baby were, that I was recovering and that the baby was staying healthy, and I was just really grateful for that and left feeling like that we'd had a wonderful experience and just felt very cared for while we were here.
I was and still am impressed with their manner and their friendliness and the proactivity, especially that Dr. Hageman showed me.
Well, my hope would be that patients feel first listened to and cared for, and that they don't feel rushed. I think for a lot of people, they sometimes feel like they're just a number perhaps in larger cities. But here we take time. We get to know our patients, we get to know their family, and we really do truly care about them. So my hope is that people feel like they've been cared for and listened to when they leave my office.